Body scan. This is a guided body scan mindfulness practice, and this is time for you to be with yourself. So it's helpful to do this practice in a place that is warm, quiet, and comfortable, and where you will not be interrupted by family, friends, and the sound of the phone. So adopting a comfortable position, whether it's lying on your back on a mat or sitting in a chair. What's important here is to find a position that will allow your body to be comfortable. Allowing your eyes to gently close. Take a moment to feel the body as a whole right now. When you are ready, bringing your awareness to the physical sensations in your body, especially the sensations of touch or pressure, where your body makes contact with whatever supports your body. Reminding yourself of the intention of this practice. Its aim is not to feel any different, relaxed, or calm. This may happen, or it may not. Instead, the intention of the practice is, as best as you can, to bring awareness to any sensations you detect, as you focus your attention on each part of the body in turn. If you find yourself falling asleep, you might find it helpful to open your eyes, or even do the practice sitting up rather than lying down. Now bringing your awareness to the physical sensations in the lower abdomen, becoming aware of sensations in the abdominal wall as you breathe in and as you breathe out. Feeling the sensations as you breathe in and as you breathe out. Having connected with the sensations in the abdomen, bringing the focus or spotlight of your awareness down both your legs, into the feet. Focusing on each of the toes of your feet in turn. Bringing a gentle curiosity to investigate any sensations you find. Perhaps noticing the sense of contact between the toes. A sense of tingling, warmth, or no particular sensation. When you are ready, on an in-breath, feel or imagine the breath entering the lungs and then passing down into the abdomen, down both your legs, into the feet, into the toes of the feet. Then on the out-breath, feel or imagine the breath coming all the way back up, out of the feet, into the legs, up through the abdomen, chest, and out through the nose. As best as you can, continue this for a few breaths, breathing down into the toes and back out from the toes. It may be difficult to get the hang of this. Just practice this breathing into as best as you can. Now on an out-breath, let go of awareness of the toes and bring your awareness to the sensations on the bottom of your feet. The soles of the feet, the instep, and the heel. Now allow the awareness to expand into the rest of the foot, to the ankle, the top of the foot, and right into the bones and joints. Then taking a slightly deeper breath, directing it down into the whole of your feet, and as the breath lets go on the out-breath, let go of awareness of your feet completely. And moving your attention to the lower legs, possibly feeling the contact of the legs with the mat, aware of the skin and the calf muscles, the shin bones, any sensations in this part of the body. The mind will inevitably wander away from paying attention to sensations in the body, to sounds, thoughts, planning, worrying, daydreaming, or just drifting along. This is entirely normal. It's what our minds do. It's not a mistake or a failure. When you notice the mind has moved away, gently acknowledge where the mind had moved to, and then gently return your attention to the part of the body you intended to focus on. Breathing into the lower legs, and on the out-breath, letting go of awareness of the lower legs and moving your awareness to the knee joints. Exploring the kneecaps, the sides and the back of the knee joints. Sensing the ends of the bones that form the knee joints. Aware of any sensations here. On an out-breath, letting go of awareness of the knees and coming now to the upper legs. Aware of the thigh bone surrounded by muscles. The skin in contact with your clothing. Perhaps sensations of heaviness, pulsations, tingling. When you become aware of tension or of other intense sensations in a particular part of the body, you can breathe into them, using the in-breath gently to bring awareness right into the sensations, and as best as you can, have a sense of letting go or releasing on the out-breath. Bring in attention now to the hip joints, the entire pelvis, possibly aware of the bladder and the reproductive organs. Feeling the contact of the buttocks and the lower back with the mat or chair. Noticing sensations of touch, pressure, temperature. Moving attention from the lower back up the spine, aware of each vertebra of the spine, aware of the muscles and the skin of the back. Moving further up the back to the middle of the back, possibly aware of the kidneys. Moving further up to the back of the chest, aware of the rib cage, expanding with each breath. Aware of the place where the rib cage attaches to the spine. Moving your awareness to the abdomen, allowing the abdomen to really expand on the in-breath, noticing the changing physical sensations as the abdominal wall rises and falls with each breath. Perhaps sensing the organs of digestion, the stomach, the liver, pancreas, aware of the intestines. Moving your awareness to the chest, aware of the muscles of the chest, the skin, the collarbones, and breathing into the entire chest, allowing the rib cage to expand fully on the front, sides, and the back. Aware of the heart cradled between the lobes of the lungs. Perhaps aware of the pulsation of the heart and the work of the heart and the lungs. Breathing into the chest and breathing out, completely letting that part of the body go. Moving your awareness down both arms to the fingertips of both hands. Aware of the sensations of air touching the skin of the fingers. Possibly feeling moisture or dryness. Aware of the fingernails. the joints of the fingers, the knuckles, the palms of the hands, the top of the hands, aware of the work of the hands. Breathing into the hands and breathing out, and moving to the wrists, aware of the bones, the skin, circling the skin of the wrists with your awareness. Letting go of the wrists and aware of the lower arms, aware of the skin and the muscles and the bones. And coming now to the elbows, noticing any sensations in the elbows, the rougher outer skin and the delicate skin on the inside of the elbows. And now bringing your awareness to the upper arms, the bones surrounded by muscles, biceps on the front and triceps on the back, the skin, the armpits. On an out-breath, letting go of awareness of the upper arms and bringing awareness to the shoulders, the ends of bones that come together at the shoulder joint. Aware of the top of the shoulders and the sides, the back of the shoulders. Noticing any sensations here. Muscles that are often tight and tense. Breathing into the shoulders, and on the out-breath, letting go of awareness of the shoulders. Moving awareness to the neck and the muscles there, the vertebra connecting to the skull. Taking a breath into the neck and throat region, and breathing out, releasing. Moving awareness up the back of the head, aware of the skull bones, the scalp muscles, the follicles of the hair, and coming further up the head to the crown of the head, the top of the head, and exploring the sensations of the forehead. Moving into the entire face now, aware of the eyes, eyebrows, eyelids and lashes, and the eyeballs resting in their sockets, aware of the nose, the nostrils, taking a breath in through the nose, sensing, feeling the air coming in, perhaps cool, and leaving warm at the nostrils. Possibly feeling the movement of tiny hairs inside the nostrils. Aware of the cheeks, the cheekbones, the skin of the cheeks, and the many muscles of the face. Muscles which give expressions to even the subtlest of feelings. Aware of the ears, the process of hearing in this very moment. Aware of the jaw, the hinged joint on either side of the face, the muscles, the jawbone, and the chin. Coming now to the mouth, to the lips, the inside of the mouth, the teeth and gums, roof of the mouth, the tongue resting on the floor of the mouth. Aware of the brain inside the head. Having scanned the whole body, aware of a sense of the body as a whole, and of the breath flowing freely in and out of the body, and a wider spaciousness around the body.